Hello, everyone. Thanks for listening about the Department of Radiation Oncology, or as we call it, the Department of Radiation Medicine here at the University of Kentucky Chandler Medical Center. My name is Mark Randall. I'm a radiation oncologist, and I have the privilege of chairing our Department of Radiation Oncology here at the University of Kentucky. I've been here going on 15 years now. It has been a fantastic place to practice radiation oncology, to work, because I get to work with such an outstanding group of people in a very supportive and high quality institution. And we feel so good about the care that we're able to deliver every day. We feel good about our academic programs. We're one of 2 radiation oncology residency programs in the state. We have a very large medical physics training program, both at the graduate and postgraduate levels. And so we're very engaged in clinical as well as translational research. So we're very happy that we're able to be in a situation that values all those missions and that we can accomplish them so well. From a clinical perspective, and that's what I'll focus on today, I just want to tell you some things about our department. We are a very busy, very high quality, a very high volume department. Those statistics are reported to the state every year in terms of the number of treatments. We at Norton Healthcare in Louisville are the 2 busiest practices in the state by quite a bit. We believe that is a very positive thing because it allows us to subspecialize. Our faculty, our clinical faculty have specializations in disease sites that give them a level of expertise that might be hard to reproduce in a more generalist practice. We also believe that the more you do of something, the better you are at it, and I believe that that is contributes to the high quality that we have. We have 6 full-time and 2 part-time faculty members. As I said, they are subspecialized. There is one exception, and that is that we have a general radiation oncology practice in Moorhead, Kentucky, that we've had for a long time. We're very happy to be able to provide care to our friends and our fellow Kentuckians in Eastern Kentucky who need our care. When I talk about volume, I'm not talking just about the daily radiation oncology treatments, daily treatments on a linear accelerator. We also have a high volume of specialized services. We probably almost certainly have the busiest brachytherapy service in the state and one of the busiest anywhere. That means the implanting of radiation sources into tumors, either by an applicator or directly into the tumor. We do a lot of that for GYN cancers that are diagnosed throughout the state. Many of them receive a portion of their treatment closer to their home and their communities, and then come to see us for those specialized treatments. We also have the only gamma knife service in the state. We have specialized providers that work with the neurosurgeons and sometimes other specialties such as otolaryngology to provide high quality intracranial radiosurgery services with the gamma knife platform. We have a very busy stereotactic treatment service. Dr. McGarry is on our faculty, is really one of the pioneers in the world for lung stereotactic treatment. So we do a lot of stereotactic treatment for lungs as well as some other kinds of treatments. We, as far as I know, are the only practice that does total skin electrons, which is a very specialized treatment for something called mycosis fungoides. We do total body radiation, which is sometimes part of a bone marrow transplantation regimen. We do prostate implantation. I already talked about brachytherapy. It's not all GYN. It's also prostate patients, and we have a great expertise in that. And the other thing I will mention is that we have created a technical platform that allows us to treat very heavy patients. And we think that patients who have morbid obesity, for whatever reason, they need to be able to be taken care of in many facilities. And it was this way for a while. We had some real limitations about the weight of patients that we could put on our treatment units. And I'll talk in a bit about some upgrades of technology and facilities that has enabled us to really expand our ability to treat larger patients who might not have an option to be treated in their communities. From a staffing point of view, we have just a fantastic staff. We have approximately 10 radiation therapy technologists that are engaged in delivering the treatments on the linear accelerators. We have a fantastic nursing staff. Some of them are also specialized to support our brachytherapy practice. We have 4.5 medical dosimetrists, again, highly trained professionals that take their jobs very seriously. And we have a very strong staff of medical physicists to help us with our clinical responsibilities and make sure that we are able to engage in the kinds of very, very sophisticated treatments that I described to you earlier. In terms of referral process, there's various ways of going about it. We have personal relationships with a lot of physicians throughout central and eastern Kentucky. Sometimes they're radiation oncologists that we know and we have each other's cell phone numbers. Sometimes they are other specialties that we know. And so one referral process is, and this happens not infrequently, is a phone call to one of our offices, my office, my cell phone, whatever the case may be. And we're happy to have those relationships. We value those relationships with our colleagues in the community. It is always possible to go through our front desk to schedule consultations. The front desk reception staff, they have information about which of our providers would ideally see the patient. They have their schedules, and they will provide that next available consultation. However, sometimes if that isn't soon enough, the best thing to do would be to speak with the physician personally and have that physician get the patient in as soon as possible. And again, we're happy to do that. We see patients on an emergency basis same day without any questions, and very, very quickly if that's what's needed. In terms of our technology, we have a very, very sophisticated treatment platform. I'll show you a little bit of it in a bit. We have 2 Varian. We actually have 3 Varian linear accelerators. One is a TrueBeam, one is what's called an IX, and the other is the newest platform, which is called Halcyon, and I'll show you that in a bit. We have CT simulators. We actually have 2 of them. One of them is dedicated to our brachytherapy practice. Another one is for our external beam planning practice. We have all the Gamma Knife, obviously, all the necessary equipment for our brachytherapy practice, such as a high dose rate remote afterloader. We have all the quality assurance equipment and the things that we would need to do these kind of specialized procedures, whether it's 6 degrees of freedom table, mobilization devices, all those kinds of things that are necessary to do the types of sophisticated and complex treatments that we do. We have, as I mentioned, a great nursing staff that's very focused on caring for patients and their family members, as is our therapists. Our nursing staff are very happy to engage social work, dietitians, other ancillary services as needed to make sure that patients get the services that they need. In terms of a patient flow process, initially things start with a consultation, and if radiation therapy is indicated, it would then be, in the vast majority of cases, would go to the CT, computed tomography simulator, for a scan to plan the radiation. Then the physicist, physician, and dosimetrist would work together on creating the treatment plan, and then it would go to one of the treatment machines to check and make sure everything was correct, and then the treatment would be executed. Follow-ups are typical. We normally see those, but we would always work with the referring physician to coordinate a follow-up schedule. So I hope that gives you a reasonable summary. I think maybe at this point, we will show just a few slides of a department renovation that we undertook and completed a little less than a year ago. So if we could put those slides up, well, we'll go through that quickly. As I just mentioned, a little less than a year ago, we opened some exciting new space and technologies within our department, and I thought I would just take a minute to show you what that did for us and for our patient experience. Next slide. We had very cramped waiting rooms because of our patient volume. So one thing we did was create a large and very aesthetically pleasing reception area and waiting area, which has actually come in very handy in the COVID era because we are able to separate our patients as they wait for their consultation or treatment. And this just reflects that expanded and very nice waiting room. Next. Just another demonstration of the waiting room. We've obviously pulled a lot of chairs out now, so we have socially distanced in an appropriate manner, and we have a TV so people can look at that while they're waiting to be called. Next. This is in the brachytherapy suite. As I mentioned, brachytherapy is a form of radiation treatment delivery that places radiation sources inside of the tumor, either into a cavity such as the cervix or uterus, or directly into the tumor in the form of a seed implant, for example, a prostate implant or other kinds of implants directly into the tumor. This is our preparation and recovery area. We have 3 bays, and patients will come into this area for their initial evaluation prep before they go into the implant suite, which is sort of a mini OR, if you will. Next. This is a CT scanner, but this is also the brachytherapy suite itself. There is a tabletop that is essentially a hospital bed in a way that lies on top of this CT table. And this is an operating room light, and we're able to perform the procedures in this room. That's where we perform the vast majority of our implant procedures. And then the patient can be immediately scanned with this. This is called a CT on rails. So the CT scanner slides over the patient and images the patient, and we can immediately see if the implant is in a good position, if it needs to be modified in any way. And then also if it's in the right location, which it normally is, then we will use those images to plan the radiation therapy delivery. In this room is also the remote afterloader, which contains the high dose rate radiation source. And so this is also the room where patients are treated if they're treated with a high dose rate remote afterloader process. I'll also mention that this CT scanner can be used for other things, although it's dedicated to the brachytherapy patients right now. But it is able to hold a much higher weight than our other CT scanner. So we can scan patients up to about 550 pounds on this scanner. And we also have a hoist built into the ceiling to help us transfer those patients without significant risk to our staff. So that's what I was mentioning earlier regarding our ability to treat patients that might not have an option of being treated in their community if their tables and technology are not able to support a weight that's often more than 400 pounds is often the limit. Next slide. This is our newest linear accelerator that I mentioned to you. This is a Varian Halcyon unit. This is the latest technology that Varian provides. It has many very favorable features compared to more traditional Linacs. It can't be used for everything. For example, you can't do electron treatments with it. And there's some other things that are better done on the other machines, but this has some really nice features. For example, it's very rapid, so treatments will be over in a very short period of time, a matter of a minute or in that range in many cases. It's very accurate. It has a very sophisticated collimation system. It's very patient friendly in terms of the table going down. And this is also a machine that will support very heavy patients that the other machines might not be able to support. And there's a number of other technical features of this that I won't go into, but this is a very popular machine now. We were one of the first to purchase it, and many people are recognizing the value and the capabilities of this machine. So it's a very popular machine as different departments look to add or upgrade their technology. Next. That is it. That constituted most of our modifications. There were some other additions, such as a staff break room and those kinds of things, but that gives you a good example of the capabilities that we added to our armamentarium a little less than a year ago. So I'll stop with that, and I appreciate you taking time to see what we have to offer in the Department of Radiation Oncology here at University of Kentucky. If you have any questions, or if you run into any issues relative to referring patients or anything, you're welcome to give me an email or work with Stephanie or Alyssa or any of the others to facilitate communication with me or a referral. So thank you very much.